All right. Hi, everyone. I'm Louise Panaligan. I'm the Vice President of Student Services here at Associated Students, Pasadena City College. And today's event is Let's Talk About It, Suicide Prevention and the LGBTQ plus community. And today we have a special guest, Dr. Marcos Briano, and I'll turn it over to him to take on the rest.
Great, thank you. It's a privilege to be with everyone here. I'm actually not in the Pasadena area. I'm actually remote in San Francisco, so hopefully we don't run into any glitches as we go along. But more importantly, it's just an honor and privilege to share with you about some of about LGBTQ and suicide and mental health. Again, today we have fun-filled, hopefully interaction, discussion, and this is kind of facts. So we're going to go over some stats and some information just to get some foundation work done. But on that note, a couple things of reminders. If you're joining us on Zoom, you can use speaker view. That usually helps out sometimes, or you can just see everything a little bit more clearly on whatever device you're using. And also, if you have the chat feature, you can always use chat and chime in with any kind of questions or any kind of Q&A. We'll have a Q&A spot for that. So on that note, let's just go ahead and launch. I'm going to share screen right now, and it's going to be the slides, and let's jump right into it. All right, so you should be seeing the first slide right now, and it's our title slide. So LGBTQ+, and the title for this is Suicide and Mental Health 101, and this is going to provide you an overview. As we discussed earlier, I am a counselor at Pasadena City College with the Personal Counseling. So I go by Dr. B, or you might hear that, or Dr. Briano. Either works perfectly fine. But we have a great set of clinicians and colleagues there. So the title is there, we're here for you. So just remember, always outreach to us. Our number is there, our email is there, and we actually have Instagram, so you might want to connect that way. So let's launch into it. Here we go. So here's a sobering slide. So LGBT youth who attempted suicide. Now there's two parameters we're looking at. This is by gender identity. So we look at our cisgender, 11% attempted suicide. We look at 21% of our transgender non-binary. And then we have 21% if we look at ages. Look at our ages, 13 to 17 years old. And then even 18 to 24, our numbers are high, 21 and 10. All this information is actually from the Trevor's Project, and it's a 2020 national survey. So we'll have that on there to do that. So unfortunately, the attempts and completions are too high. And let's kind of discuss that. And let's kind of look at the objectives we want to go over today. So here's what I hope that you get out of this. One is I hope we can increase your knowledge and awareness of just suicide and mental health for LGBTQ community. And when I say that, I'm going to focus more on the youth because that's where the stats are coming from. But again, this can apply across the board. Again, we're looking at differences and similarities, but we're going to be talking about a community as a whole. Number two, I hope to also challenge some misinformation and myths that are out there. And while this is not a stat class, and I'm not teaching in a stat professor hat right now, we're going to have some numbers on there. So don't get fearful of the numbers and just kind of take in the numbers and go like, wow, if I had 2 and 3 people around me that were LGBTQ youth, 2 of us will be experiencing this or have this or reported this. So we will put that in that framework for you. So don't worry about, you don't need a calculator, you don't need any math background, we're going to get you right through this. All right, so here's a question I like to pose. So what percentage of college students have had suicidal thoughts? Some of you may think this number is a low number, maybe in the middle number, it might be a high number. So let's see what the research says about that. And it's over 50%. Now, some of us may ask is like, okay, so what are these warning signs? And so I'm gonna just flash on some warning signs for you that are out there. So isolation, changes in sleep patterns, sadness, hopelessness, depression, decreased energy, irritability, crying spells, loss of motivation. So many of you as students may say, you know what, as a student, I go through a lot of these. And does that mean that I want to hurt or kill myself? Absolutely not. However, we get to a point when students get to the leverage of like hopelessness to a different degree. So we can look at these as kind of signs and warning signs of other things that may be going on. As I tell students all the time, going to school, this is not a normal process. How many of us get bombarded with all the reading, all the exams, all these tasks that we have to do? That's not normal. So even though life is difficult and we have different challenges and obstacles that we may do, we have to put that into perspective. So now I'm going to give you a different lens when we look at this. So let's look at LGBTQ lens. So now we have some other things that you might have heard this word, intersectionality. These are these other layers and upon things that come up. In this case, LGBTQ identity. That's another layer that we have to consider. We also have to consider lack of resources and support. There may be not as many resources and support, especially when we talk to our community of our transgender and non-binary community. We have to be mindful of that. Other thing that's huge, physically threatened or harmed. Huge thing. Unfortunately, many of our LGBTQ communities are being threatened, bullied physically, and harmed. And this is not okay. Another thing that we see with our youth is homelessness. And this is a big one. It's like we have those we call, couch surfers. They're just, surfing from place to place to find stability. Now imagine having a student and having all the stressors of school, possibly working, possibly dealing with family, and then not having a place to live and to shower and just for the general needs that we need for ourselves. It just makes it really complicated and it compounds this problem 10 or 20 times fold. So we got to keep that in mind as we kind of navigate that. All right, so here's another question that I like to pose. So what are some current challenges faced by LGBTQ plus? Now I'm gonna show some of these on there, and we're gonna talk about a few of them because I think this is not an extensive list by no means, but it talks about some of the areas that are just really impactful, especially when we start thinking about wanting to end our life. So stigma, resources, safety. How many of our LGBT community feel safe? Discrimination. Look at what's going on currently in the world. All this divisiveness, all this kind of, we're taking away a lot of, rights, and some of these things are being questioned. As many of you have probably watched the debate recently, how visceral that was and how that also gave a sense of like, wow, what does this mean for me? And it means something very different for each and every one of us. But think of it how that elevates, especially when we have things taken away. So this is where we want to talk about discrimination, house instability, like we talked before, mental health access and service. You might be surprised about mental health access and services. Another big one is acceptance, understanding. Do we know what pronouns mean? You'll see on mine, I have he, him, and él. And these are things that we want to be mindful of. Not only just the pronouns, but we want to be mindful about the innuendos about our different cultures and differences within our own communities. So there's another layer that adds into that. One thing that I do know, if we do not use proper pronouns, it can be so hurtful on many different levels and we might misidentify someone. So we want to be careful of not making assumptions. Affirming spaces. We have Quest at PCC, which is a affirming space. We have a safe space. So these are those areas we want to improve on. That's been called by the researchers like, are there enough affirming spaces? Fear of being outed. This is huge. Most of our LGBTQ plus communities are not out. And there are many different reasons why one may not be out. There can be family, there can be financial, there can just be not ready at that point in time. So we'll kind of explore that at a later time about outing and about what that looks like and what that may feel like. Ability to afford care and services. I don't know about you, most students don't have a full-time job and everything is financially okay. This is where it becomes another added on thing that we have to consider is having enough funds to pay for care and support. Family support systems, huge, huge. And there's a list of many more. So I'm not going to sit here and tell you everything about it, but there's a lot more to kind of look at. All right, so LGBTQ youth who have considered suicide. Look at the numbers. When we talk about cisgender, I hope you understand what that word is. That means that as they were born as a male, they identify as a male. That's what cisgender means. So terms are going to be super important to understand. When we talk about a transgender, a non-binary, they don't see things as just two, like female and male. So they're going to see non-binary, and they'll take on that identity. And so we'll look at our numbers. 34% considered suicide for cisgender youth. 52, that's half of transgender and non-binary. Huge, huge numbers. So I want you to take this one home a little bit more. So of those who considered suicide, these are the numbers that attempted. Look at that. Cisgender, 33%. So of the 34, 33% actually attempted. Same thing we look at transgender. The number's a little bit lower, but there's also an attempt there. So what's the take-home message of this slide? When someone is thinking about or considering suicide, we've got to make sure we link them, because look at the attempt. Now we hope the attempt doesn't turn into an actual suicide. That's what we want to avoid. So we want to be mindful of when someone is talking about considering, we've got to make sure we get them linked in. And we'll talk about how we can link them in later. So mental health stats. Here's something that might be surprising. So those who seek counseling from a mental health provider, yes, but I didn't get it. That's almost half, 50%. Maybe some just didn't need it. They just said, no, I don't need it. That's about 20%, about 1/4. And yes, I was able to get it, and I got it. 38%, about 40%. So if you look at that pie and go like, wow, there's a problem here. We have about 50+% that are not connected, and why? What's going on? So we have to understand that. So these are kind of I'm giving you all the pieces to this puzzle to try to figure out what we can do next on the next phases that we kind of look at what we can do. Here's some more things. So generalized anxiety, I know that we call that GAD within the framework of counseling and psychology. Look at this number. 2 in 3 LGBT youth have experience of generalized anxiety. 3 in 4 transgender and are non-binary youth. Huge number. So you just imagine you have 3 youth right there. 2 of them have experienced generalized anxiety. Now, as students, you may say, yes, I'm always anxious. There's a lot of anxiety. So there may be multiple reasons, but that's a good question. It's like, what is causing that and what's elevating that? Let's look at depression. I think depression is another one that we look at. So major depressive disorder, 1 in 2, it's about half, 50%. 2 and 3 transgender, almost 75%. So we're looking at big numbers. Now, I want to dispel one thing. I think that's what's always out there is about, oh, if someone is self-harming, does that mean that they're going to commit suicide? Are they have active thoughts of suicide? So that is not necessarily true. However, we want to understand that better. So that's going to take another level of understanding. But here's some numbers that might be interesting. 48% engage in self-harm behaviors. We know cutting, it might be a way to do that. That's probably the primary, but there's many other ways of self-harm, burning, different things, because it gives you that feeling, and it gives you that increase of our neuroreceptors that gives you that feeling that feels a little bit more safe, in the sense that I have and feel those feelings. So we have to be mindful of that. But look at our numbers. 60% of our transgender and non-binary engage in self-harm behavior. So in totality, we have to look at this and look at the mental health component. Huge component. Anxiety, depression, and self-harm behaviors. All super important to consider. All right, one more stat on mental health, and then I'm gonna have a challenge for everyone here. So I'm gonna put 2 charts up here. Now they're asking the same questions, but they're looking at the data a little bit differently. So when you look at it, you're gonna notice some interesting information. So in general, inability to afford across the board is problematic. Concerns about getting patient care permission, still problematic for both our transgender and non-binary and our cisgender. Then we get into something that I think students can appreciate, transportation. Yeah, how do I get to these facilities? If we think of the LGBT Center in Los Angeles, That's not a direct red line. You have to sometimes, you have to walk a little bit if it's really hot. We know the weather is here. So transportation, how do I get from Pasadena or from wherever I'm located to an LA area where they have the LGBT center? Fears of being outed, again, super high. Previous negative experiences. Unfortunately, as we know behaviorally, if we had a negative experience in the past, we kind of go like, you know what? I don't think it's going to be helpful. Just like as a clinician, I think of when I help students and we talk about coping skills. You might have been given a coping skill by one of my colleagues or just tried a coping skill yourself. Was it effective the first time? I hope so. But the reality is we know it may not have been. And that's okay. That means you have to tweak it. You have to figure out to see if there's a better fit or a better way to do it. Same thing with my colleagues as clinicians. Sometimes it's just a better fit. So looking for that fit is super important. So don't just throw out your first experience and go like, yeah, that was horrible, wasn't helpful. I want you to be curious and go like, I wonder if I see someone else or talk to someone else that might be helpful. So think of it that way. And last, you're going to see right here, lack of providers. Unfortunately, there is a lack of providers. So my challenge to all of you students is like, we need you. We need you to finish into your master's level. Come and be a marriage family therapist or social workers. Get your master's level. And if you can, strive even more and dream and go for your doctoral degree. We need you. And I know you can do it. That was my dream. And I was like, I've had a lot of obstacles that said, you know what, you can't do it. You're not going to be able to make it. And you have to push against that and go like, you know what, I can and I will. And look for those supporters around you that are going to get you there. So that's just my message to you, to hopefully you to be part of our team as we move forward. All right, diversity. Diversity is big and I want to make sure I address it. How youth identify. Look at this picture here. I think it's amazing. Now, some of these terms you may or may not know. And if you don't, here's my challenge to you. Challenge. I want you to look up and learn any unfamiliar identities on here. Some of them you may know, or some of them you're like, I've heard of, but I'm not sure what that means. So my challenge to you, and I will give these slides as PDF and we'll post them somewhere, is for you to go like, what does the word gender flux mean? What does that mean? What is, I think people maybe heard of butch, but not sure what that means and how that identifies someone. So look at these. I think we heard of pansexual. Some of these are kind of, queer. Some of them are just like, I've heard of it, but I'm not really sure. So if you're on that spectrum of, many of us are like, I've heard of it, but I'm not sure what it means. My challenge to you is to look that up. And there's about 40 or so on here. You don't have to do this in one sitting. So I wouldn't encourage that. Maybe take on one of them a day and go like, I'm gonna increase my knowledge about LGBTQ identity to have a better understanding. Because if you can have a better understanding, think of how much you can help others because you get them. And I think that's super important. So keep that in mind as we kind of go. So that is my challenge to each and every one of you. Now, I just want to chime in about a couple services we have here. Obviously, I'm from Personal Counseling. We have telehealth services there. We have Zoom services, so you can see us in the Zoom interface. Or if you don't like that, we could do full telephone, and that's perfectly fine. I'm told this is no longer the telephone sign. I'm told like this is a telephone sign, so I'm dating myself if I do this. So bear with me with that. And we have COVID-19 resources. We have a lot of different resources for you, as long as, and many of our different support resources here on campus. And lastly, student health support is also, the student health office is open. So make sure you check this out. You pay for this with your student health fee, so make sure you activate it. So here's my last thing before we go to Q&A, and I want you to stay tuned. So this is my little PSA for you to stay tuned. The reason why is that we're going to do what we call a follow-up. And we're going to kind of look at what you can do. So now that you have this information, understand like, wow, there's some things going on. What can we do? And I believe, so yes, so this is kind of what we want to be mindful of. I want to challenge us all to go like, okay, now we understand there is some problems and there's some areas that we can identify. So my challenge is not only just to identify those problems, but like, how are we, each and every one of us that are watching this, are going to be systemic and make those changes to make the decrease in the suicide. We don't need this anymore. So we have to help each other and to form that community as we move forward. And then lastly, I have some information for you. Make sure the slide goes on. Contact information. So personal counseling, that's all the information there, which we showed in the first slide. But I more importantly want to give you my information. So if you need to reach out, you can always reach out to me and I will connect you. Briano at pasadena.edu. And you can also do personal counseling at pasadena.edu. We will be there to help you and connect you. If you just want to get more information, we can drive you to that too. So just look at us as a resource. So just to connect. Connecting is important, just like that was in one of the slides. There wasn't enough resources. Yes, but I couldn't do it. That's not okay. So we got to change that mindset and we got to change it. So I'm going to stop sharing right now and I come back into the room. And I'm wondering if there's any questions or anything else folks may have in regards to about LGBTQ and suicide and mental health. Obviously, they go hand in hand. It's not a one and this, it's kind of like in collaboration, in conjunction to, it adds into what our LGBTQ youth are experiencing. So we have no questions yet. But I like to remind you as we move forward, this is part of the resources that we're going to be offering. I hope that you were able to get some information about suicide and some stats that just weren't scary stats, but informational in the sense that now I have a better understanding of what I can do and how I can help. So I want to also encourage you to stay tuned because the next time I hope to present, we're going to talk about what we can do. We're going to break this down a little bit more and go like, got it. We got the global picture of, yes, it's a problem and understanding the problem and identifying the areas that are problematic. As good researchers, as most of us have taken research classes, you can't just go like, here's the issue, just go at it. You got to understand it. You got to understand the elements of it before you move forward. So that was the goal today. It's going like, let's kind of dissect it a little bit and go like, what are those elements that we need to work on? And one of the big things that we can do is, as students, is kind of like, do you know terms? Are you using pronouns? All of us are on Zoom right now. Do you go and change your name and do you put your pronouns on there? I'm going to challenge you to even do that. And folks may ask me, why do you have pronouns on there? What does that mean? Especially if you use they or their. They may go, what do you mean they or their? So while I know it's hard to be informative and always repeating, but I think that's a challenge that we can do. It's like, this is what a pronoun means. And these are my pronouns. And we want to get away from preferred. It's not a preferred pronoun. These are my pronouns. So I know in the past we used, what are your preferred pronouns? That we take out the preferred. What are your pronouns? So my pronouns, as I said at the beginning, are he, him, and él. Él coming from Spanish, so knowing that I can speak Spanish and have another area to talk is really great. So this is right where you add your flavor, your individuality. So I encourage that as you move forward and as we help and support each other to hopefully decrease suicide and to increase awareness.
Hi, Dr. Briano. So I actually had a quick question for you. I know this is something that I heard maybe through the grapevine. So I was wondering, are you currently looking into like a peer mentor program on campus?
Great, thank you. Okay, so we do have a peer mentoring program on campus, and I and my colleagues have been working on this for a couple of years. We have currently 5 peer mentors. And let me just give a little shout out to the peer mentors. The goal of peer mentors is sometimes, and I know it's easier to maybe talk to another student. Sometimes coming to maybe a staff member, or in this case, me as a clinician, or even your professor can be a little daunting and maybe a little uncomfortable and hard to do. So PCC has engaged what we call the peer mentor program. It's going to be launched under Raise Your Hand to connect to PCC. So we're in the mix of doing that right now. But the idea is for you to have the ability to talk to another student. Now, they're not clinicians, so they're not going to be able to give you a diagnosis of anything, but they are going to be that window that if you do need that next level of support, they're connected with us. So imagine how easy it is for that transition to maybe talk to myself or any of my colleagues to give you that additional support. We want to break the stigma of personal counseling. It's not because you have this disorder and you have this label. We're not there to label you. We're there to help you and connect you. And as you may or may not know, PCC has a ton of support services, and this is an example of one of them, clearly. So we want you to know about them so you can engage in them. So yeah, so peer mentors are available through personal counseling, and you can always ask about that. So thank you for that question.
Yeah, actually have a few more.
Sure.
I know that, sometimes asking for help can be scary. And especially like, asking the school can be scary because you don't know who you're talking to. What can they expect when they call for an appointment, or is there any confidentiality that comes with it?
Yes, excellent. So let's talk about confidentiality. Confidentiality is super important, and it's kind of the bedrock of counseling in general and psychology. So here's the information about confidentiality. Everything remains confidential when you talk to any of the clinicians and also our peer mentors for that matter. The only time we will ever breach confidentiality is if you want to hurt yourself. So we got to make sure you're safe. So we're going to breach confidentiality because we got to connect you to other resources. If you want to hurt or kill somebody else, we got to make sure that other person's safe. And as you know, faculty, staff, in general, we're all mandated reporters. So we have to be mandated reporters for child abuse, got to make sure the children are safe, elderly abuse, and dependent abuse. So those are the issues that are confidential. So if someone were to call, your faculty calls, your professor calls and goes, hey, is so-and-so being seen by your office? We would say this: we can neither confirm nor deny that. That means and that's going to keep you safe because we're not going to release that information out. And parents may call also, by the way. And again, we will not release that information unless you do what we call a release of information. Then we get information. Better than that, that remains there.
Thank you. Thank you so
Yep.
much. I don't see any more questions in the chat, but thank you so much for sharing some PCC resources and also creating this very engaging and informative session for us. Like Dr. Briano said, there will be a future session where it will be more interactive. We'll get students involved during a Zoom so we can kind of talk more about, kind of place the discussion more about this. And I hope you all stay tuned. I just want to thank our partners, PCC Personal Counseling, of course, Health and Wellness. And I just want to throw in Quest in there just because I know that they are very great at what they do with helping LGBTQ plus youth at our school. So yeah, thank you so much. Do you have anything last to say? No.
Thank you, everyone. Stay safe. I know that this time is trying for each and every one of us. You are not alone on this. So again, utilize each and every resource we have at PCC. Like, I may not have all the answers, but you know what? We can connect you to different resources that may be able to help you out. So humility is super important. And like I said, we're here for you. Just have to reach out to us, or as PCC would say, just raise your hand and you connect to us. So either way, just connect and make sure we can support you, and at least we can hear you. I think that sometimes hearing is super important. Sometimes you just need someone to listen. Just, can you listen to me? And how it feels to get that out is just amazing. So yeah, thank you.
Thank you, and stay tuned, everyone. See you next time.
That was awesome, you all. Thank you. That was great.
Good.
I'm still waiting on the stream to end. I hope this part doesn't get in it.
I think we're still live.
And there you go.